Hey guys, it's Nurse Gwenny. Let's talk about holiday heart syndrome. This is a binge drinking induced episode of atrial fibrillation in patients who have no other cardiac history or the risk factors for AFib. Typically, these patients present with a chief complaint of palpitations, and they self-admit to, yes, I was drinking last night. And it's people who don't typically drink a whole lot on a daily basis. So one thing that we want to do with these patients, of course, if they're hemodynamically unstable, we're going to sedate and cardiovert these patients as quickly as possible. However, a large portion of these patients will self-convert as long as we can correct any underlying electrolyte disturbances. There's a high incidence of hypomagnesemia and hypokalemia in these patients. And once we correct that, corrects this rhythm for a lot of these patients. Now, of course, we want to treat these patients prophylactically to prevent them from developing thromboemboli, because we know the blood is just swirling in the right atrium when our patients are in AFib instead of being pushed forward into the right ventricle. So these patients are at a very high risk of developing a clot. Usually we'll follow these patients, we'll bring them into the hospital, admit them, put them on telemetry, monitor their hemodynamic status, and they usually will self-convert if we don't have to convert them using calcium channel blockers or beta blockers or that cardioversion. And then we'll follow up with a cardiologist and watch them over long term. For 90% of these patients, a single episode is all that will happen, but in some of these patients, we will see a resurgence of it, a recurrence of this in future binge drinking episodes. So I hope that helped you guys out. Next time you're taking care of a young patient who wouldn't normally present with AFib, you can ask them if they were drinking, and you know you've got holiday heart syndrome.